Moving over to look at opioids, this is one of the things that we have been talking about for quite some time, and we're familiar with how we can potentially treat this in the field. This list right here are some of the more common opiates and opioids that you might see, some of them by prescription, some of them street drugs, some can potentially be purchased both ways. An opioid itself is a type of narcotic medication used to relieve pain, so we know the opiate is the subset of the opioid family and refers to natural, non-synthetic. So again, that one's found in nature, most of the time with plants. The opioid is man-made. So those terms can be used interchangeably, and this dependence can occur after taking a medical prescription, and that's how a lot of people become addicted to opioids. And we've discussed this before, how sometimes, yes, it is an intentional use of street drugs that leads to this, but sometimes it starts out with a prescription from a recent surgery or a dental procedure, and the person just cannot get off of the pills. So they start eventually turning to other ways of obtaining them, and then eventually street drugs. These are central nervous system depressants and can cause severe respiratory depression, which is the main potential life threat here. The tolerance develops very quickly, which means that they need more and more to keep up that same feeling. It can also often cause nausea, vomiting, and potentially hypotension. These patients may appear unconscious and cyanotic with pinpoint pupils. So again, the physiologic things that we're looking for here are pinpoint pupils, respiratory depression, and possibly hypotension. The biggest thing that we're gauging our treatment off of is known or suspected use of the opiates combined with the respiratory depression. That's why we're going to be giving it, not when the patient is talking to us. So again, to reverse this, we would use naloxone or Narcan, which is an opiate antagonist, which means that it's blocking the response from occurring. It can be given intravenously, intramuscularly, or intranasally. Now, intranasally is going to be the only way it can be given at the EMT level for in North Carolina. We want to find out if, from bystanders, if the patient has already been given any Narcan. A lot of times this is something that they will ask about if 911 was called and they were given some of this information. They may have already asked about this if some was given to the patient prior to EMS arrival, and if so, how much. So very important that we have that. The biggest thing, I'll just go back to this for a quick second. The biggest thing with opioids is that we manage the airway first. So if you see test questions that ask about that, remember that yes, while the patient might still need Narcan or other treatment, the main concern here is managing the airway. So that should be done first, ventilating for the patient before we progress with any other type of treatment. We know that the goal with administering Narcan is not to wake the patient up, because then they might experience anger, they might start vomiting, they might have withdrawal symptoms. Our biggest concern here is simply just to increase the respiratory drive. That's our goal for administration. Looking at sedative and hypnotic drugs like barbiturates and benzodiazepines, these are easy to obtain and relatively cheap. They are central nervous system depressants that can alter the level of consciousness. The patient might appear drowsy, peaceful, or intoxicated. Generally, these are taken by mouth, and occasionally the capsules might be suspended or dissolved in water and then injected. There are IV sedative and hypnotic drugs, and if they are used, then they quickly induce tolerance. So the patient builds a tolerance very quickly to these. They can be used or given to people in a knockout drink, so thinking about roofies, something that is going to remove the memory around the event. Your treatment is to ensure that airway is patent, assist ventilations, and provide prompt transport. There's not a lot that we can do to remove this from the system or to combat anything that's happening within the body, just simply rapid transport and assisting the ventilations if the respirations become too hindered. Looking at some abused inhalants, so some different things that can be inhaled like acetone, glues, cleaning compounds, paint thinners, those are big ones. Gasoline and halogenated hydrocarbons can also be abused. So we talked previously about the aerosolized keyboard cleaner. That's one example. These are commonly abused by teenagers because you can obtain them fairly easily and you don't have to be of a certain age. For some things you do for this very reason, but for some of them you still don't. The halogenated hydrocarbon solvents can make the heart hypersensitive to the patient's own adrenaline, so even the action of walking can cause a fatal ventricular dysrhythmia. So we never want to have these patients walk to the truck. We want to make sure that we are utilizing a stretcher, we're giving oxygen, and that's really what we can do here is just administer oxygen to help get some of that out of the bloodstream, replacing those chemicals with oxygen on the hemoglobin and removing them from the environment. Looking at hydrogen sulfide, this is a highly toxic, colorless, and flammable gas with a distinctive rotten egg odor. It affects all organs but has the most impact on the lungs and central nervous system. It can be used to commit suicide. So if you suspect the presence of this toxic gas, we want to wait for that hazmat team to tell us that the scene is safe. Remember, we don't want to become overcome by any of this. Some potential signs and symptoms early on would be nausea, vomiting, confusion, dyspnea, then a loss of consciousness, potentially seizure, shock, coma, and maybe even cardiac or respiratory arrest. Once the patient has been decontaminated, then the management is going to be largely supportive. If we need to assist ventilations, if this is a cardiac arrest, we still need to decontaminate the patient once they've been removed from the area prior to initiating compression so that we ourselves don't become overcome. Looking at some sympathomimetics, and we looked at a few of these previously, but these are central nervous system stimulants that mimic the effects of the sympathetic or fight or flight nervous system. And we said that some of these can be things like epinephrine and albuterol, but these on the left-hand side are some examples of street names for sympathomimetics. So some of these you may have heard of before, like angel dust or PCP, coke, which is obviously cocaine, ecstasy, ice, MDA, meth, molly, speed, all of these different types of street names for these medications that mimic that central nervous system. So a stimulant is an agent that produces an excited state. So it's frequently going to cause hypertension, tachycardia, and dilated pupils. So those three things, very important that you understand what that means. If you see these three things in combination together, it's almost a very safe bet that the patient has ingested some type of stimulant. Now, cocaine can be taken in a number of ways. It can be absorbed through the mucous membranes or across the skin. That's why people will often snort it through the mucous membranes of the nose, but it can also be mixed into a liquid. It can be injected. The immediate effects include excitement and euphoria, but they last less than an hour, so you're constantly needing more. It's a very expensive habit to have because the tolerance builds very quickly. An acute overdose here is a genuine emergency. These patients have a high risk for seizures, cardiac dysrhythmias, and strokes. The patient may experience hallucinations or paranoia. We should never leave them unattended, and we should consider prompt transport. Again, not a lot that we can do to reverse things here, but treating their signs and symptoms, and a lot of times lowering their body temperature and having ALS on standby for seizures are going to be a big deal. Looking at bath salts, this is an emerging class of drugs similar to MDMA, sold as bath salts to escape the legal restrictions imposed on illicit drugs. These produce euphoria, increased mental clarity, and sexual arousal. Most users of this drug snort or insufflate the powder nasally, and the effects can last as long as 48 hours. Some adverse effects include teeth grinding, appetite loss, muscle twitching, lip smacking, confusion, GI conditions, paranoia, headache, elevated heart rate, and hallucinations. We want to keep the patient calm and transport. We can consider ALS. They might need to chemically restrain or sedate the patient depending on are they a threat to themselves, to you, or to someone else there. That's going to be our main concern. I'm sure that you guys have all seen videos or heard news stories related to someone who has been taking bath salts and what can actually come from that. Marijuana, this is one that's abused throughout the world. THC is the chemical in the marijuana plant that produces the high. It produces euphoria, relaxation, and drowsiness. It impairs the short-term memory and the capacity to do complex thinking, and it can progress to depression and confusion. High doses can cause sometimes hallucinations, anxiety, and paranoia, and that's where we see a lot of EMS calls related to marijuana. Not that the effects are going to be lethal, but usually we get calls related to the anxiety and paranoia side of things, especially if this is their first time using. And when it's mixed with other things, that's where it starts to become more dangerous. So when it is used as a vehicle to get other drugs into the body, that's where it can become a life threat. Several states have legalized the recreational use of marijuana, and others allow it for medical use or products that contain THC, like edibles. Ingestion of marijuana can lead to cannabinoid hyperemesis syndrome, so that's uncontrollable vomiting. Synthetic marijuana or spice refers to a variety of herbal incense or smoking blends that resemble the THC and produce a similar high, but it has very powerful and unpredictable effects that can result from ranging simple euphoria to complete loss of consciousness. And then hallucinogens, these alter a person's sensory perception. So a classic example here is LSD. Another you may have heard of is going to be PCP. These agents cause visual hallucinations. They intensify vision and hearing and generally separate the user from reality. So they may be experiencing a quote-unquote bad trip and have hypertension, tachycardia, anxiety, and paranoia, again, which is where you might receive the 911 call. We want to use a calm, professional manner, provide emotional support, not use any restraints unless the patient is in danger of injury or they're at risk of injuring you or your crew. We want to watch the patient carefully throughout transport, never leave them unattended, request ALS assistance when appropriate, again, most likely for sedation. Anticholinergic agents, we said this, they were medications that block the parasympathetic nerves, and so this would be like your atropine and pralidoxime, potentially diphenhydramine. So a little saying that goes along with this to help you remember the signs and symptoms that can come from an anticholinergic overdose would be hot as a hare, blind as a bat, dry as a bone, red as a beet, and mad as a hatter. So those are the things that it can cause. It can cause the body to become overheated. It can cause visual disturbances. It can cause dry mouth, dry mucous membranes, cause redness or flushing to the skin, and cause some type of delirium. So mad as a hatter. The patient can go from normal to seizure and death in 30 minutes. So again, being very cautious about administering high doses of some of these. And then cholinergic agents, these are used to overstimulate normal body functions that are controlled by the parasympathetic nerve, so nerve gases, organophosphate poisonings, things like that. This is one mnemonic to help remember the signs and symptoms, which is dumbbells, but the more common one used is sledgem, which is what we've been referencing throughout the class, and we described these in the first video, so I won't go through those again, but again, essentially just every possible orifice that can produce some type of liquid is doing so, and that's where you start to see a lot of distress coming from the patient as they become dehydrated and just overall very upset about what's happening. The most important consideration is to avoid exposure yourself, so decontaminate the patient. If you are close enough to recognize what's happening, you are too close. So now you are most likely going to be at risk as well. So really something to consider based off of the call-in information, and as you're starting to approach the patient looking for potential red flags that could lead you to believe this before you actually make contact with the patient. After they've been decontaminated, we want to help decrease the secretions in the mouth and trachea, provide airway support here. If we have those duodope kits, that's going to be the best bet. If a known exposure to a nerve agent manifests with signs and symptoms, again, you want to go ahead and use it on yourself. Don't wait for your signs and symptoms to start. Go ahead and self-administer, self-inject, let the hospital know, let medical control know, but go ahead and self-administer as well. And then looking at a few other miscellaneous drugs. So remember that overdose with cardiac medications has become pretty common. So that's any number of things that a patient could be prescribed. Looking at beta blocker overdose, calcium channel blocker overdose. These signs and symptoms are often going to depend on what specific medication was used. So we might need to contact poison control. Aspirin poisoning remains a potentially lethal condition as well. This takes its toll on the kidneys, but it can happen very quickly. Ingesting too many aspirin can result in nausea, vomiting, hyperventilation, and ringing in the ears. Patients may have anxiety, confusion, tachypnea, and hyperthermia, or may be in danger of having seizures. Overdosing with acetaminophen or Tylenol is also very common and can lead to a lot of liver damage. Alcohol as well, even if it's not drinking alcohol, can cause severe tachypnea, blindness, renal failure, liver damage, and eventually death. Food poisoning, this is almost always caused by eating food contaminated by bacteria, which is the organism itself causing the disease, or potentially organism producing a toxin that causes the disease. The salmonella causes this itself, so it does not produce any other bacteria. It is the bacteria that causes this. So this is characterized by severe GI symptoms within 72 hours of ingestion. That includes nausea, vomiting, abdominal pain, and diarrhea. Proper cooking of food helps kill bacteria, and proper cleanliness in the kitchen prevents contamination of uncooked foods. So like storing your chicken on the very bottom level of your refrigerator to keep it from dripping onto other things, that's one way to prevent salmonella poisoning. More common cause of food poisonings is ingestion of powerful toxins produced by bacteria in leftover food, like Staphylococcus, which is quick to grow and produce toxins. Food that's left unrefrigerated is a common vehicle, so making sure that your leftovers don't sit out overnight, especially meats, making sure that they are refrigerated and stored before they are reheated, and that you're not reheating and then refrigerating, reheating, and refrigerating, because that's how these toxins can grow as well. The most severe form of toxic ingestion is botulism, and this can result from eating improperly canned food, and these symptoms are usually neurologic, so blurring of vision, weakness, difficulty speaking and breathing, so a definite potential life threat here. It's not up to you to determine the specific cause of the GI problems, but gathering as much history as possible from the patient, transporting promptly, and again, if 2 or more people have the same illness, we want to take along any suspected food or alert the restaurant if there were more than one case of someone who ate there last night or yesterday sometime, so that they are aware. And then plant poisoning. Many household plants are poisonous if ingested, so we want to notify poison control and take the plant with us if we can. One of the most common that you're actually going to see here is one of your Christmas plants, and that are things like mistletoe and your hollies, and also your poinsettia. I can't think of the name. Poinsettia is also poisonous, so a big deal for children that could potentially come into contact with these. So that's going to be it for toxicology. So I'm going to stop this video here, and I will catch you guys in the next slideshow.